I know everyone's always reluctant to be the first one to start the ball rolling, so I might do that. One of the things Fergal talked about was kind of the fast pace of, decision making now and the pressure ministers and government are under, and John talked about equity seeking groups and what they say. So, I mean, one thing that strikes me working in the teaching department, we have a child poverty unit, a new disability unit, and we're aware there's a very active lobby group backed up by a research function who very often put their solutions to government. And very often they're understandably want to deal with the hard cases that the parents are bringing to them. So I just wonder how the policy system sort of incorporate that perspective, because I wasn't quite sure it was, it was touched on but wasn't really explored. So there's more than one avenue of knowledge or one channel of knowledge feeding into government. And I just wonder how it sort of reconciles these, John, you talk about ways of knowing. I just wonder how it reconciles these different things, because they can be all talking about the same problem, but it's back to your elephants. They're addressing different parts of the elephant. So I just wondered about that. So, Fergal, do you want to?
Yeah, I think you're absolutely right. And one of the things I was always struck by was the agility of lobby groups of various forms to formulate their view of the world very, very rapidly, often faster than we could in government departments. And in a way, that's understandable because they have a very, very specific perspective, and they're often very, very skilled at injecting that particular perspective, not just into the government departments involved, but also to the media. And almost the first thing you hear in relation to a debate on any topic is the view of a particular organisation or lobby group who may or may not have a particularly well-reflected approach. So to me, I think I always regarded that as an important but not the sole element of injections into the policy debate. And I think one of the things, the challenge is to make sure that he who speaks loudest is not necessarily the person or group that has necessarily the most to say, although in fairness, obviously, we would listen very carefully to what they do say. So for me, it's a question of balance, listening to them, but also then trying to reach out to other perhaps less organised, less well-functioning groups to make sure that their views are involved as well. But I should say it's not to dismiss lobby groups in any way, and many of the representative groups, I'm thinking when I was in the Department of Children, some of the umbrella groups in particular were extremely good at objectively and in a balanced way representing the temperature, so to speak, of the sector on a particular issue, which I always found very, very helpful. And particularly if you have a good working relationship and a respectful one where you can lift the phone and say, look, what is the mood? What are the thoughts on this? And that can be taken into account. But I stress, it's the balance.
Yeah. Okay, great. John, do you want to?
Well, I think stakeholder input, absolutely critical piece of the policy process. And they're also going to be a vehicle for some forms of evidence to get to the table. But you want to make sure that you have more independent mechanisms to surface all the relevant forms of evidence, and then that can be part of an ongoing conversation. So if they've come forward and selectively zeroed in on particular drivers of the problem or particular solutions, you can come back, again, within a few business days and say, well, we see a broader array of framings of the problem that may be helpful here. We see a broader array of solutions. So they're critical on the political dimension. They can be an input on the research evidence side, but ideally the evidence they bring to the table is put in the bigger context of all of the systematically and transparently brought together evidence on the issue.
Okay, great. Thanks. I'll come back to you on that broad array of framing. I think you were touching on something very interesting.
Yeah, no, I suppose, one thing that strikes me there is that piece, and I suppose particularly the work that's coming out of your own department around the policy handbook and bringing a bit of transparency around the policy development process and kind of highlighting the different sources of, I suppose, policy development, not just around the evidence piece, it's just been that one piece, but the legitimacy piece and the feasibility piece that you spoke about earlier on. And I suppose, as Fergal was saying, lobby groups, they can bring a very important insight as well. But I suppose it really brings to the fore the need for those skilled policymakers and how they balance those different components of policy development and evidence.
Yeah, great. Okay, thanks, Leonora. Just turning to the audience, you have some questions there. The top one there. the concept of uncertainty absorption is fascinating and chilling. How can we guard against this on both sides of the conversation? So I think, Fergal, this is saying when you're sort of diminishing the kind of, I forget the known unknowns, the Rumsfeldian term is, you'll tell me what it is, but, you know, but I think is maybe overselling the policy option and having a degree of modesty. And something that experienced civil servants said to me about the policy handbook, prioritise the do-nothing option. You know, elevate that can be very legitimate in and of itself. So.
Yeah, I mean, I think the concept of uncertainty absorption is one that struck a chord with me when first I came across it many years ago. I attributed it to Basil Chubb. I'm not absolutely sure if he was quoting somebody else, but I mean, the basic argument is that civil servants can, wittingly or unwittingly, present their proposals in such a way as to lead the minister, to try to lead the minister inevitably to the one solution that they want. I think the main thing, the main way of regulating or dealing with that is, number one, being conscious of it. Number two, there's an element of trust that should build up between ministers and senior officials as to what they're saying. And number three, I suppose it's the issue of objectivity and being able to step back from where you passionately believe and being able to present all sides of the argument. But again, it brings you right back to evidence, to an evidence-informed policy, which, rather than just presenting a limited number of considerations, is structured sufficiently to take account of the different factors and the different implications. So it's as much as anything else that you have to be aware of and to guard against. And I should say, ministers aren't naive. They generally very quickly pick up on something if they clearly are seeing one side of the argument. You can also acknowledge the fact that, look, they have other forms or channels of communication and advice, including their own advisors. They're far better than we officials ever were at getting the view on the ground from the voters, and that's a significant element as well.
Great. You remind me, it was Harry Truman who said he called for one-handed economists, because they had on the one hand, on the other hand. So, but John, I mean, what do you? I mean, you presented a fascinating overview of how you do this incredibly sort of comprehensive but rapid, you know, overview of knowledge. But does that include sort of knowledge deficits, what we don't know, and
Yeah, I think we're always trying very hard to say, what do we know, with what confidence and with what caveats, and what don't we know? And inevitably, there's going to be a lot of things that we don't know. And, you know, in the policy world, the context shift, the issues shift, and in our world, the evidence shifts. So we need to be honest, this is what we know at this moment in time. And I see a question about how do we make trade-offs in rigor. You know, I guess how we approach it is we provide the best answer we can in the time that we are given, and we are very clear about what we were able to do and what we were not able to do. And what we often say is, look, if you give us 2 more weeks, here are the additional bells and whistles we can add. So we could find every study in the world, but we could only do risk and bias assessments on 5 out of the 30 studies. We did the ones that we thought were most relevant to you. With another 2 weeks, we'll get them all done. We'll extract information on equity. You mentioned, Barry, equity deserving groups coming to the table. We try now always to have an equity dimension to our question. What have we learned? How does it vary by groups and contexts, particularly for equity deserving groups that are the focus of a conversation? So I think you're trying to do the best you can in the time you have. Be clear about the limitations. If you're given more time, incrementally make it better. And this is also true of these AI-enabled living evidence syntheses. Now, instead of disappearing for 6 or 12 months, we give you the first draft in 2 weeks. We say, is this close to meeting your needs? Then it keeps getting better over time until eventually it's really hitting exactly what you need to know, presented in the best way. So when we have a bit more time, we can add the bells and whistles.
Okay. We might come back to that, because I think that is a fascinating area, something that struck me. Leonora, do you find that academics are suitably modest about what they don't know when they're coming into departments? Or?
Well, I suppose it is one of the things that we are trying to communicate to researchers when we're engaging with them, is that to be clear on the limits of the scientific evidence as well. You know, I mean, like I said, we're kind of getting, or only skimming the surface really of understanding the evidence supply in the higher education research sector, and there's an awful lot of expertise in there that can, I suppose, maybe mitigates against some of those uncertainties that we're talking about. But at the same time, I think it's one of the things that, as part of the training and part of the, I suppose, building that transparency and that trust in policy making, is just making sure that researchers feel that they can convey the fact that they're just uncertain about things as well, and the answers may not be out there just yet.
Okay, great.
Maybe if I can just add to that, Barry, if I may, just in one context, I touched on it very briefly at the end of my presentation, and that's the argument about whether researchers, when they're presenting something to government departments, whether they should offer recommendations or simply policy implications. And for me, I always found it more helpful if researchers focused on the policy implications of different approaches as opposed to being perhaps overly prescriptive on recommendations, because they may not necessarily have all of the background on which to make that decision. Now, in some instances, they may be specifically asked to make recommendations, but I think in many instances, presenting the evidence as it is with the implications connected to it, I think is much more powerful.
Okay, great. Just the next question, the top one there, is sort of phrased euphemistically. It must have been written by a civil servant. What's the panel experience of refreshing policy where evaluation indicates poor impact? I think this is a code for when do we close it down. But I mean, I think it is a problem. We always think it's particular to Ireland that, you know, we have these, you know, pilots that go on for 20 years, for example, and that we never want to be applying the kind of the guillotine to something. But Leonora, I mean, do you find that academics are able to say, well, look, this isn't working, we've got to stop, we've got to try something else? I mean, is it easier for them to say it?
I don't know if it's any easier for them to say it, but I suppose one of the things that I would say is you'd hope that, I think, that maybe by building those kind of partnerships and better kind of engagement between the two sides and having that kind of building that trust between them, that maybe there might be better, that they might be better able to kind of say and be honest about when things are working, and I suppose, or even not working. And I suppose as policy and as research is moving on, that you continue with that engagement, so that you're not kind of. I think one of the problems that we sometimes have is that if there's engagement with researchers and policy makers at the beginning, and then there isn't enough engagement as projects or as research is ongoing, then you know you might have a little bit more of a risk of that kind of thing. So just the importance of, I think, maybe connectivity might help in terms of, I suppose, identifying failure. Well, I don't want to say failures, but maybe things that are not working as they're moving on.
Yeah. Fergal, do you?
One is just connected to that is a hobby horse of mine is we're very good often at developing policy. Sometimes we're good at implementing it, but we're terrible at policy termination. We're actually very poor, I think, and I'm expressing a purely personal view here, at actually saying, no, that didn't work, we're going to stop it. And that is really quite a difficult thing in a government department to say, yeah, we tried that. We set up this program. We worked our way through it. We implemented it. It didn't work. It's very, very difficult, particularly for a minister, to do that. So I suppose in terms of policy refreshment, I can think of a few areas where, as we were developing something and had started the process, we reached a conclusion based on the results so far, based on market research, testing the market and so on. We actually reached a conclusion. I'm thinking of one in particular in the Department of Children where we said, this actually isn't going to fly. And we found a way of taking an alternative approach while still going for the same objective. But I think it takes a lot of courage and it takes a lot of rigour to be able to say, yeah, we tried something. We genuinely believed on the basis of the evidence that we had and the analysis that it was going to work. But actually, no, it's not going to work. And it's hard for a minister to do that. So that's the pragmatism, building in the reality of everyday life into the process.
Yeah, okay, great. John, I suspect the next one is right up your field. There's a long version, a short version. The short version is at the bottom. Is AI great? The longer one is, could John say more about the AI-enabled synthesis project? I think we're all interested in what use or value can AI add to the research endeavour? And I think you've touched on this, but could you tell us more? And particularly, I think the limitations, particularly there's more and more academic commentary about the limitations of large language models now. Perhaps not this sort of general panacea or this artificial general intelligence people talk about. So what's your experience of using AI?
Yeah, well, I don't think there's any solutions now that would replace our unit or other units that are similar to it. But I think what it has forced us to come to terms with is we've privileged rigor for so long, and we need to get the balance better between rigor and speed. And which is why so many of our groups, you know, Barbara and I sit around a table with people from 12 countries, all of whom are trying to move down to these 1, 2, 3 day turnaround times for what's already out there, how does it fit into the existing context. So I think that piece has been a game changer. And where AI comes along, I think most of us are committed to safely and responsibly incorporating it in different parts of the synthesis workflow when that's appropriate. So right now, you can, instead of going to PubMed and EconLit and so on, you can now suck in every single day all this stuff from OpenAlex. You can now rank order those documents by their probability of inclusion based on the ones you've already assessed, and keep up on this incredible fast-moving space. But can it be used to do a risk of bias assessment currently? No. Can it be used to responsibly pull out qualitative themes? No. But it will keep getting better at all of those processes. And then eventually we will have agentic models that can mix and match, like when I described at the beginning a scenario with a policymaker where in one business day we can put 20 people on it to do that. In future, we'll probably get quite close with AI. But then, again, it's about using the AI tools as they can be safely and responsibly incorporated and setting them loose on walled gardens where you know what you're dealing with, and then it can't completely hallucinate. So it is a game changer. We're, through ESSIC, really interested in that safe and responsible incorporation. And as we move to these policy scale living syntheses, they're going to be absolutely critical. Because if we want to move away from a world where every 5 years we look at breast cancer screening, every 7 years we look at prostate cancer screening, we look at should we do mental health screening in general practices, we need to line up all those preventive services and say which ones do we proactively offer to each population group. To do that, we need to be answering stuff at a completely different scale than we've ever done before. So we have to start to use AI in appropriate ways.
Okay. I'm just thinking 1 to 3 days turnaround. I'm just thinking how long a briefing folder takes to go up and down the line in my department. So it does seem like revolutionary. Just maybe the middle one there is interesting. How do we communicate the quality and nuances of modelling studies to policymakers, and what tools do you use to evaluate the quality of those models for policy? Fergal, do you want to?
Well, certainly, I mentioned in my talk the importance of actually communicating very clearly to policymakers, but I also made the point, and I'm not the first person to make it, that the communication isn't sufficient. It's a necessary but sufficient condition, I suppose, the economists would say. So one of the things that busy policymakers will want is the short version, not the long version. And some of the most effective communication that I have seen from researchers have been those who have developed 1-page, 2-page summaries with clear, very focused messages about what the whole research or the approach was about, what the messages are. If you can communicate that properly in a short period of time, then you can provide any amount of detail thereafter. In terms of judging the quality of it afterwards, I think the best way is almost understanding the extent to which policymakers were then able to take it on board. If a minister or a senior civil servant can say, yeah, I saw that, it makes sense, it gives me this particular weapon, or it helps me understand this particular facet, then I think it is a job well done. But I absolutely appreciate the nuance, the extent of detail, and the work put into so many pieces of research. It's a real discipline to distill them into their key messages, but an absolutely vital one for our purposes.
Okay.
Barry,
Yep.
can I just ask,
Yep.
Modeling, I'm sorry to interject, it's just with the Global Evidence Commission, when we were trying to come up with an understandable logic for policymakers of different forms of evidence and when they added value, we ended up with 8, which you heard me talk about, and Barbara's going to come back to it. And for every one but modeling, there are well-accepted quality criteria. We know how to assess trials. We know how to assess qualitative research. We know how to assess whatever it is. There are no accepted criteria for modeling. And so during COVID, we were always asked by policymakers, what's the best evidence, and include modeling studies. But we had no way to differentiate the modeling studies. And when we'd phone modelers, they only like their own model. They never agreed that anybody else's model was any good. So it remains this black box to me. I don't know what to do with modeling studies because I can't get modelers to agree on what basis would we know whether a model is good or not.
Okay. Leonora, this is something that comes up in your group a lot, access to peer-reviewed literature, and I'd be interested in John's take. So again, this metaphor of TAP. Do departments need access to all the top-level journals in their field, or do they need access to intermediary like John, who has access to all the top-level journals in a particular field? I'm just wondering about direct or indirect.
Yeah, it's an interesting one because there's been an awful lot of discussion, as you say, about this across the policy sector and about opening up or how we open up access to academic journals and who needs them and who uses them, etc. And I suppose one of the things that I would say is that Evidence Synthesis Ireland very kindly have been supporting us. We had an evidence synthesis workshop with policymakers earlier in the year, and one of the things that came up with them is how they feel that it's not just about getting access to the journals, but it's about actually having the skills and the capacity to actually absorb them, to understand them, to know what's good evidence, to determine whether this is something that's applicable to the area that they're looking at. So I think access to journals, I suppose, as I mentioned with the graph, there's a kind of a growing number of civil servants with those kind of deep research skills, and I suppose they probably feel a little bit more confident in terms of accessing journals. But I think that for the everyday policymaker, for a lot of us who came in as generalists, there's a certain amount of, I suppose, trepidation there in terms of, okay, it's great that I have access to the journals now, but how do I know that I'm actually pulling the right ones together and understanding them, synthesizing them? So I think there's still like a real important role there for researchers in terms of interpreting and presenting the evidence, and back to Fergal's point again, around the dissemination and communication piece and distilling the key messages. So it's definitely something that we're looking at, but there's a capacity issue that needs to be dealt with there too.
John,
Yeah.
what?
Well, a typical document we would produce, let's say in 2 business days, we may have looked at 17 evidence syntheses and, 9 studies from the Canadian context, and they're answering different pieces of the issue, because sometimes we're asked only to unpack the drivers of a problem. Other times people want to know, what do we know about the benefits and harms of the different solutions that are on the table? So I don't know, is it necessary that policymakers have access to each one of them? To us, what's more helpful is, here's the totality of the evidence, here's the recency of it, here's the quality of it, here's the applicability to the Irish context. And yes, there may be a time where in that totality, the Irish policymaker wants to see those 2 particular studies or that one synthesis, but it feels like that's a surmountable problem. Is it worthwhile having these blanket subscriptions for those very rare instances? I'm not so sure how I'd spend that marginal dollar that way.
Yeah, okay. I know we're running short on time, so just might be the last question. How do you manage ethical approval? I think that's very good when you're talking about speed, and you'll talk balancing speed and rigor, but how do you manage ethical approval in such a tight time frame in rapid local research, especially when including qualitative insights?
So how we've seen it done is that you submit a research ethics board submission for the general parameters of a study, and then you submit an amendment the moment you have precision over exactly who you want to interview, how you need to adjust your interview guide, and so on. And we've seen it done successfully many times. And so the moment the policy question comes in, within 24 hours, you can have an amendment request in front of an REB. And usually for those types of amendments, in our context and many others, you can get an answer within 1 or 2 business days. So you can immediately be in the field.
Okay, great. Fergal, you might comment on this. The media are a huge influence on what makes it onto the policy agenda and what solutions are acceptable. Could the panellists comment? Oh.
Certainly, the media are always a very large influence, and sometimes you feel that they pick a particular issue because it's of public interest in their judgment, and yet those of us who have been developing a policy in a particular area might have had a very different view indeed. Certainly, number one, they're of very substantial importance because people read them. But number two, I think it's important or potentially valuable simply to reach out to them rather than simply reacting. I found personally, and I think other departments have done it to varying degrees, if there's a major public issue that there is a debate required on, reaching out to media, particularly those who are specialised, let's say, in the health area or the social services sphere or whatever it is, reaching out and offering a briefing can be very, very valuable in contributing to the debate as well. Inevitably, media will have different views and want to focus on particular issues, but you can try and help focus the agenda to a certain extent by reaching out.
Okay. Great. Folks, we're just in our last 10 seconds or so, so I won't be invited back as chair because I think I've run 10 minutes over, so apologies. But you have an opportunity for coffee now, but we will be back here again at 11:10, so the next chair can get things back on track more efficiently. Just to say, please, just a round of applause for our panel meeting. It's great, really stimulating. So,